How does the draining cerebrospinal fluid affect the pressure in the brain with patients having subarachnoid hemorrhage? Major terms: aneurysmal subarachnoid hemorrhage, bleeding in the space between your brain and arachnoid. Intracranial pressure, pressure inside the skull. External ventricular drain, a device that removes fluid and monitors ICP. And cerebrospinal fluid, fluid protecting the brain and spinal cord. Basic information of the experiment. Subarachnoid hemorrhage raises the pressure inside the brain dangerously because the cerebrospinal fluid around the brain doesn't flow properly. So doctors will often use a tool called external ventricular drain to relieve the pressure. Ilsi drain trial found out that adding another tube in the lower back after subarachnoid hemorrhage treatment can help the patients to recover better. The study included 287 patients. 221 had a brain drain placed in the head and 140 had one in the lower back. Researchers used patients' data from the Aguilar drain study to look at how much cerebrospinal fluid was drained and how high the brain pressure was during the first 8 days after the subarachnoid hemorrhage. Adult patients with a bruised brain aneurysm were randomly assigned to either receive standard treatment or standard treatment plus an additional lumbar drain. Researchers looked at how much cerebrospinal fluid is being drained and how high the pressure got to see how this affects the recovery. They tested. From the lumbar drain group, they started draining cerebrospinal fluid once at post-treatment CT scans showed it was saved. The goal was to drain 5 millimeters of fluid per hour, regardless of the intracranial pressure levels. Intracranial pressure levels were monitored regularly and recorded particularly at 7 a.m. and highest value each day during the first week. Their neurological recovery was measured using the modified ranking scale at 6 months after the brain bleed. The results were divided into two categories: a good outcome scored 2 or less, and poor outcome scored above 2. New brain injuries were checked using the last brain scan, either CT or MRI, before the patients left the hospital. What they found: draining more fluid through the head was linked with more brain damage. Draining more fluid through the lower back was linked with less brain damage. Patients who had worse recovery tended to have a higher brain pressure. Patients did better when more fluid was drained using the lower back, which suggests that draining a larger amount might help protect the brain. About 40% of the patients also have secondary strokes due to a poor blood flow after the initial bleeding. When it came to patients who developed new brain damage, their maximum ICP levels didn't differ from those who didn't. Patients whose ICP went over 25 millimeters Hg had worse outcomes than those with lower pressure. Of the patients, 176 had a good recovery with a score of 0 to 2 on the modified ranking scale. On average, patients in the study had about 1,052 millimeters of cerebrospinal fluid drained in the first 8 days after the treatment from the brain bleed. Patients with poor outcomes had much more cerebrospinal fluid drained through EVD. More drain through external ventricular drain may be linked to worse outcomes. High ICP wasn't linking to more new damage. In this picture, we see how much spinal fluid was drained in 98 patients who had either a brain drain or a lower back drain. In chart A, they show the total amount drained from each person, from the smallest to the largest. In chart B, show the average percentage of the fluid that came from each type of drain. Both of these graphs look at the highest brain pressure that is measured each day in 187 patients. Below the graph tells us the days starting from day 1 to day 8. On the left side tells us the intracranial pressure. In graph A, you can see each day is put into two groups. Light green are the patients with good outcomes and the red being the individuals with bad outcomes.
In most of the bad outcomes, there tends to be a greater intracranial pressure compared to good outcomes. In graph B, patients were grouped in having infarctions, which is colored dark green, and no infarctions, colored brown. But between both groups seems like a sort of equal amount of intracranial pressure, which doesn't really show a difference whether patients had infarctions or not. Limitations. Only single daily ICP reading were taken, so pressure over time couldn't be analyzed. Not all patient care details were recorded, such as how and when the drain were used or whether patients were awake or sedated, which could affect brain pressure. A common problem after subarachnoid hemorrhage is the vasospasm, which is the narrowing of blood vessels that affected 70% of cases and makes the treatment harder. How does this finding help us? Managing on how much cerebral spinal fluid is drained and preventing pressure spikes in the brain could help improve recovery after a type of brain bleeding like subarachnoid hemorrhage. Lumbar drainage helps clearing blood and toxins more efficiently and reduces harmful immune system response in the brain, though this is just a theory and needs more research. Opinions. We agree with this study because it looked for another way in which cerebrospinal fluid can be drained. That's not directly from the brain. It also looks at not only how much cerebrospinal fluid is being drained, but also the intracranial pressure, which they were also testing with the external ventricle drain, and both play a big role in having subarachnoid hemorrhage. And this is our citation. Thank you.